You're listening to a Raconteur Studios podcast.
Hello, lovely listeners, and welcome back to another episode of the After Hours Skin Clinic. I'm Dr Emma Craythorne, a consultant dermatologist, and I'm joined by my colleague, Dr Ellie Rashid.
Hello.
In this episode, we're chatting about one of my favourite subjects, which is myth-busting. And today's episode is focused on Botox, or botulinum toxin. We are not sponsored by Allergan.
No, we are not.
Okay, so first up, is it a myth or a fact? Botox is toxic and we don't know the long-term effects. Over to you.
So in terms of whether Botox is toxic or not, I guess any ingredient can be toxic depending on the dose and the delivery method. Like if we compare it to caffeine, for example, if you'd have 80 cups of coffee, that would be toxic, but you enjoy 2-4 cups of coffee without any problems at all. So although it is a neurotoxin, it is not toxic because the doses that it's delivered at are not at toxic levels.
Exactly. It is probably one of the most toxic biological substances that we have known to man. But at the doses that we have, like you say, is not going to be enough to cause harm. So the typical lethal dose for humans is about 3,000 units. And when we're injecting, say, for example, for full facial treatment, that might be somewhere in the region of about 50 units. So 3,000 units is the lethal dose and 50 units is what we're injecting. You think about water, water's really good to have some water in a day, but if you have too much of it all at once, well, that's toxic.
Yeah, it is.
The dose makes the poison.
Yes. Oh, well done. That's the expression I was looking for.
Yeah. So then let's move on to what the long-term side effects, I suppose, would be of botulinum toxin. I'm just going to jump in and just say we don't know what the long-term side effects are because what is defined as long-term. But I suppose it's been being injected now for around about 40 years, 35, 40 years. And the side effects of multiple injection points are perhaps slight atrophy of the muscle that's being injected. In other words, that muscle can get a little bit thinner the more you inject it. And that's why it's important that, the right doses are being injected, the doses are modulated whenever they are being injected. And perhaps you're not injecting the muscle, you're injecting the skin rather than the muscle underneath directly. So that is one of the long-term side effects. But actually, in truth, a lot of the long-term side effects are actually pretty positive side effects whenever we think about things like flushing, hyperhidrosis, elastosis of the skin. What do you think?
Quality of life. Massive difference for quality of life in people. When you're injecting it, we're always going to do doses that would be safe. And also we never start that young. So you're not going to be treating someone every 3 to 4 months from their sort of teenage years or 20s. Most of the patients we're treating from their sort of 40s onwards. So myth or fact, Emma Craythorne, if you stop doing Botox, wrinkles will get worse.
Well, that's a fact. Because the idea with using botulinum toxin, if you're using it for things like facial wrinkles or photo damage of the skin, well, what tends to happen is then that the muscle activity underneath the skin starts working again. And therefore, as that muscle contracts, the overlying skin then gets the wrinkle appearing within it. So if you start having botulinum toxin, you're reducing the appearance of that wrinkle. And if you stop having botulinum toxin, then the wrinkle is there just as it was before. So it doesn't get worse because you've had Botox injections at all. That's not the case. It doesn't get worse. But if you're not having them, then you're just back to what your baseline was. Yeah.
If anything, sometimes you're a bit better than your baseline because of what we were talking about, that sort of emotional response that you have. So if you have Botox, therefore you stop frowning, you actually relearn, so you don't make that movement so often.
Yeah, and also as one of our kind of mentors always used to say, Andrew Markey, it's also about that elastic recoil in the skin.
Yes.
So meaning that, yes, you get the improvement because the muscle's not moving, but also the skin itself has a better elastic recoil and that improves. So your wrinkles improve with Botox injections. If you stop having them, then you're essentially back to baseline, but probably a little bit better than what you would have been. If you carry on having your Botox injections, then they will carry on staying better than they would have been, or generally improved or vanished, really.
Yeah.
I remember actually being maybe like 28, and I remember being in a nightclub actually in Ibiza, and somebody asked me what age I was, and I said what age I was, and they said, "Oh, I thought you were older because of your eyes, my like eye crinkling." And I remember thinking, "Oh, right, my laughter lines, I laughed a lot." But actually, I think whenever you then have botulinum toxin repeatedly, which over those many decades since, then actually not only does it treat those wrinkles that are dynamic, but because of this improvement in the elastic recoil in the skin, it also improves them as well on the very surface of the skin. And if I were to stop having those Botox injections now, then my skin's not going to go back to what it was before at all. It would just still stay better than what it would have been. Does that make sense?
Yeah, of course it makes sense.
Yeah.
But also, you're never going to go back there.
I go back to Ibiza, the nightclub, but
Yeah,
not
you
come
won't
back
go,
there.
You
with
won't
the...
go back there with the wrinkles, no.
I quickly want to say that if you're enjoying these episodes and like what we stand for here at the After Hours Skin Clinic, then please do me a favour and click subscribe. We're just starting out and it really helps us grow and reach more people. My team and I would really appreciate your support. Anyway, enough of that and on with the episode. So, Ellie Rashid,
Yeah.
fact or fiction, like a box of Pringles, once you pop, you just can't stop.
I think this is fact, because I think once you've seen the benefits that you can get for your skin, you don't want to go back.
Yeah.
I think what people do is they just eke out how long the Botox can last for, the benefit of it can last for. So rather than having it 3 or 4 times a year, they might have it twice a year, for example. But they do want to keep going with it.
Yeah.
Because it does lead to that improvement in elastic recoil, improvement in their overall skin texture, improvement in their flushing, sweating. So I do think once you start and you have those positive benefits, you often don't stop.
Yeah. And you're wanting to have it done again because you've seen the positive benefits, not because you have to, in the sense that, your skin's telling you have to have it because you've had it before. It's your brain probably telling you, hey, you look so much better last month.
Yeah. You look so much more relaxed.
Mummy, why are you frowning? Have I done something bad?
Cheer up, love. I need my Botox. Myth or fact, Botox is permanent?
Botox is not a permanent outcome change to the skin. So once you have the injections done, they take around about 5 to 2 weeks really for some people to have their effect. They, depending on which preparation of botulinum toxin you've used, because there are many, even though we keep saying the word Botox, there are many, and there's actually a new, longer lasting version of a botulinum toxin preparation. And so at the most, you're really getting around about 6 months at the very most of effect of it, and then it is worn off. And essentially it wears off because what happens is the receptors have regrown and the acetylcholine, which jumps across the synapse, is then working again. And so your muscle activity takes over. And the same thing happens if you're having it done for glandular reasons or for flushing reasons. The botulinum toxin wears off and you're back to your baseline or a little bit better. I sometimes think that people get confused with what botulinum toxin or Botox is and what fillers are. So sometimes people think that these are exactly the same thing. So are they the same thing?
No. So Botox and
I
filler,
I did know the answer to that.
just to let you know, Emma, they're not the same thing.
Man.
So botulinum toxin is a neurotoxin that helps with relaxing muscle contraction. And fillers are often from a substance called hyaluronic acid, comes in different viscosities or sort of thickness or how runny it might be or how viscous and thick it might be. And that's usually injected into the skin, usually to improve your own hyaluronic acid production, but also for remodeling of collagen. It can have a benefit, but the biggest benefit for it really is to try and replace some lost volume that one might have. So it's a completely different ingredient from the get-go. We also use it in different contexts. One is to relax muscles for flushing, neuromodulation, pain, and the other one is usually given for enhancements in volume and to improve hydration.
Yeah, and we should probably do a whole episode on fillers actually, because there are so many. I mean, gosh, I remember like starting out and there were just a few brands of fillers, and now there are thousands and thousands. So that would be a good topic we should do as well. And that's a wrap for today on the After Hours Skin Clinic. Thank you for joining me, Dr Ellie Rashid, while we were able to talk about all things botulinum toxin, fact or fiction.
Thanks for having me. It's been wonderful being here.
We've got so much more we want to share with you. So if you enjoyed this episode and would like to help us out, then please do subscribe. And you can also leave us a review below. So until next time, take care of yourself and your skin. Please remember your SPF, and we'll see you on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.